What's going on, guys? Welcome to another presentation, and today we're going to discuss pancreatic disorders. So definitely follow this video up with my liver disorders presentation, or start with that video first. Now, the pancreas is a gland within the abdominal cavity, and it mainly functions to produce enzymes that aid in digestion. So here are some of the enzymes produced, starting with trypsin and chymotrypsin. These are what help break down proteins in our small intestine. Amylase, on the other hand, is what helps digest carbohydrates, furthermore breaking them down to simple sugars. Lipase now is the enzyme that breaks down fat and insulin, which I'm sure you guys are familiar with, and it is what decreases our blood sugar, okay, insulin. Lastly, there's also another enzyme that is secreted, and this will, on the other hand, increase our blood sugar, and that is glucagon, guys. Now, the disorders we're going to discuss today are cholecystitis, which is inflammation of the gallbladder, acute and chronic pancreatitis, and lastly, pancreatic cancer. So we're going to start with cholecystitis, and this is inflammation of the gallbladder, which is usually caused by gallstones, guys. Now, the gallbladder is a muscular sac that sits inferior to the liver, and it stores bile, and bile is used to help emulsify or break down our fats, guys, the fat that we consume. Now, risk factors are things such as obesity, a diet that is high in fat, and lastly, genetics. Genetics play a role in a lot of disorders. Now, clinical manifestations of cholecystitis are things such as right upper quadrant pain, because the gallbladder is located in the right upper quadrant. Also, nausea and vomiting, as well as tachycardia, which is that increased heart rate, may be manifested, and something called Murphy sign is going to be present. This is pain upon inspiration when we inhale air, Murphy sign. Also, there may be signs of jaundice due to the fact the gallbladder is what stores bile, and within this bile is bilirubin, which is a byproduct of erythrocyte breakdown. So if we have backed up bile, we will have backed up bilirubin, which in turn will cause yellowing of the skin, which is in my liver presentation. Also, steatorrhea is going to be present, and this is greasy stools, guys. Why are the stools greasy? Well, bile is what emulsifies fats, so if bile is being backed up, there won't be no emulsification or proper emulsification, therefore fat will just be evident within the stool. Now, also dark urine and clay-colored stools will be present, which is also due to the backed up bilirubin. So treatment for cholecystitis starts with NPO status, which means nothing by mouth. IV hydration with isotonic solutions, that of our 0.9% sodium chloride, and lactated ringers, guys. These are going to supply that vascular expansion that we need. Also, correcting fluid and electrolyte imbalances are going to be important because they have their own complications. Now, surgical management is also a step that can be taken, and a cholecystectomy may be the way to go, and this is removal of the gallbladder. Ectomy means removal, okay? So when you hear ectomy, this means to take out. Usually the prefix is what is being removed. Medications used are things such as NSAIDs, and I've listed examples in parentheses, and you guys remember NSAIDs, they serve as analgesics, meaning they reduce pain, also as antipyretics, which reduce fever, and anti-inflammation, which reduces inflammation. Now, Demerol is going to be given, and this is a narcotic, also named meperidine, and it's going to treat pain. Now, very important, morphine will and should not be given in the case of cholecystitis because it will increase the pain even more. And guys, we are given these analgesics because more than likely these patients are in pain due to gallstones within the gallbladder, which is blocking circulation. Now, antiemetics are also going to be given, and these are things such as Zofran or metoclopramide. These are the meds that prevent vomiting or emesis. Lastly, antibiotics will be given in the case of any infection, in which a culture and sensitivity test must be done first to see what antibiotic will be chosen or used. So when assessing, we're going to monitor vital signs, assessing for an increased temperature signifying a fever, which is signs of infection, guys. Also, checking the heart rate and respirations is important because we want to make sure tachycardia, which is an elevated heart rate, and tachypnea, which is elevated respiration, is not present, okay? We don't want those. Also, we're going to want to look at the liver enzymes, AST and ALT. We're checking the skin turgor along with monitoring the pain status of the patient, which is going to be very vital, okay? We want to make sure pain is reducing and the skin turgor is normal. Remember, turgor of the skin refers to the elasticity, the stretch and recoil. We want a normal skin turgor. Doing abdominal assessments and checking the appearance of stool is important as well. We're going to want to monitor if there's still fat in the stool. We're going to want to monitor the abdominal pain to see if there is any tender pain. We're also going to want to see if there's any Murphy sign, that pain on inspiration. Daily weights in eyes and nose will be done to check for proper ingestion as well as excretion, and to evaluate whether or not proper fluid fluid balance is being achieved. We're also definitely going to want to monitor the nutritional intake and adjust it if needed. Because remember, if there's liver damage or cholecystitis present, we're going to want to reduce fat and protein within the diet, guys. Now, our next complication is acute pancreatitis, and this is inflammation of the pancreas. And being that it is acute, it is a reversible disorder, okay? Chronic is not. Chronic lasts a lifetime. So causes that attribute to this disorder are gallstones as well as excessive alcohol. Now, gallstones will cause obstruction of flow from the pancreas as well as the liver. So we're also going to have similar liver problems as well, guys. The clinical manifestations seen are things such as epigastric pain in the left upper quadrant to the center of the abdomen, because this is where the pancreas is located. There will be feelings of abdominal fullness, by signs of gas and bloating. Also, a fever may be present along with an elevated heart rate and a decreased blood pressure. So tachycardia and hypotension. Also, guys, we're going to see hyperglycemia, which is an increased serum blood sugar level. And this is due to the fact the pancreas produces that insulin. Therefore, if it is inflamed, it won't produce enough or it won't produce any insulin, leading to hyperglycemia and increased blood sugar. Remember, insulin decreases blood sugar, so if there's no insulin, blood sugar will be elevated and stay elevated. Now, when diagnosing a possible pancreatic disorder, if we see an elevated lipase level, this will confirm that there is an abnormality within the pancreas, because lipase is only produced by the pancreas, guys. No other organ produces lipase. Other signs that are seen are Cullen's and Gray-Turner signs. Now, Gray-Turner sign is bruising that is manifested on the flank, and the flank describes the areas such as the lower back and the sides or the upper abdomen, okay? Now, Cullen's sign is bruising around the umbilicus, the belly button. Now, to decipher them, just know one so you know the other. Cullen's is around the umbilicus area, and Cullen's has a U in it, so use that U as umbilicus, okay? Now, bruising in these areas will indicate hemorrhaging, which is bleeding, as well as severe inflammation and tissue damage. Now remember, if the liver may be involved due to the obstruction of flow, due to those gallstones, we're going to be thrombocytopenic, and that hemorrhaging won't be able to be corrected. That's why the bruising will be so evident. Now, treatment is going to start with that NPO status. We don't want this person consuming anything to prevent further complications. Also, IV isotonic solutions are going to be given to provide that fluid volume maintenance. And if other organs are involved in this disorder, these patients will be transported and treated within the intensive care unit, the ICU. Lastly, we're going to treat the cause of pancreatitis to begin with, which is either due to the gallstones or the alcohol consumption. So assessment starts with things such as monitoring vitals. There's going to be an increased heart rate as well as respirations and a decreased blood pressure due to the pain. Okay, pain will trigger tachycardia, tachypnea, and hypotension. Checking lab values are vital as well, such as the lipase levels, which are going to be increased. We want to make sure they are decreasing, guys. Also, looking at the amylase and glucose levels are going to be important. We're also going to want to check the appearance of the stool due to the liver problems as well. Now, something called pleural effusions can occur as well, and this describes fluid that has found its way into the pleural cavity, furthermore compressing the lungs. So this is a complication that can cause atelectasis or pneumothorax, which is a partially collapsed lung or a fully collapsed lung. Pneumothorax is the fully collapsed lung. Atelectasis is a partial collapse of a lung, guys. Now we're going to discuss chronic pancreatitis, and this is inflammation of the pancreas that is irreversible. It is chronic. So there's going to be major enzyme imbalance, and causes are due to things such as prolonged alcohol use or cystic fibrosis, which is when fluid piles up within various ducts and passageways, furthermore becoming thick and sticky, suppressing proper functioning, a very serious complication. Clinical manifestations seen here are going to be similar to acute pancreatitis because the pancreas is inflamed. So pain in the upper abdominal region spreading to the back, that flank pain is seen. Here, pain is actually increased after eating or drinking, and there's going to be nausea and vomiting, guys. And when we vomit, we lose fluid and electrolytes. Therefore, hypovolemia may be a complication, and hypovolemia's manifestations will be manifested, such as weight loss. Okay, fluid will further be lost by means of diarrhea, and that's also going to cause electrolyte imbalances. So it's going to be important to maintain it with IV hydration. Also, that paler colored stool will be seen due to the lack of bilirubin in it. Instead, it's in the circulatory system, causing that jaundice. And lastly, steatorrhea is present due to bile being backed up, and if bile's backed up, fat can't be broken down properly, okay? Now, pain management is very important for these individuals, as well as IV replacement, guys. Remember, there's possible hypovolemia, so given isotonic solutions are going to be important. We're going to manage the electrolytes due to the vomiting and diarrhea because we are losing them through those processes. Now, the patient may question, why is the insulin being implemented? I don't have diabetes. I don't need the insulin. Well, this is where the education is going to come in. We're going to want to provide that education to inform the client that the pancreas creates insulin, and due to the fact that it's inflamed or obstructed, very little or none of it is being produced. That's why their blood sugar is high. So given this insulin will decrease the blood sugar, ma'am, or decrease your blood sugar, sir. And if they say something else after that, just leave because it ain't happening. Anyway, when we give pancreatic enzymes, guys, which is our next treatment, we're going to want to give these with or just before meals, and this aids in digestion. So we're going to want to implement them in the plan of care, and pancreatic enzymes such as creone or pancreatin are examples. Now, this is very, very important. These enzymes must be taken with acidic foods, so we're going to want to avoid alkaline foods such as milk, ice cream, or even pudding. These enzymes do not work well with alkaline foods. We need optimal functioning. So we have to keep in mind the acidity that may build up in the stomach can further cause ulcerations and metabolic acidosis. Therefore, we're going to want to give acidic controlling drugs such as our H2 antagonists and PPIs, okay? Our PPIs ends in prazole, okay, such as lansoprazole, and our H2 antagonists ends in dine, like our cimetidine. You dine with H2. These are going to decrease acid within the stomach. Also, guys, H2 antagonists are not for long-term use due to the fact they will cause cognitive declines. So we're going to want to cut those off or use them intermittently. Now, assessments are going to be similar as well due to the clinical manifestations present, such as monitoring the vitals, as well as the glucose, lipase, and amylase. We're monitoring everything, okay? Lastly, we're going to want to monitor the weight, pain, the abdomen itself, the skin color, and the stool. We're going to want to look at everything to make sure everything is going well, okay? And we reached our last disorder, which is pancreatic cancer, guys. And if you've watched my cancer presentation, woohoo to you, because you'll understand this a bit more. Now, the pathophysiology behind pancreatic cancer is defined by loss of mitotic control of the pancreatic cells, resulting in rapid growth, which causes deterioration of both the exocrine and endocrine function of the pancreas. A loss of mitotic control refers to there being too much mitosis, too much cell or tissue growth. Now, causes of this cancer is not fully understood, but the risk factors, of course, are things such as smoking, a diet that is high in fats, meats, fried foods, refined sugars, and nitrates. All the good stuff. They just contribute to the bad complications. Now, nitrates would point to that carcinogen exposure, and carcinogens are the main trigger for cancer, guys. They evoke carcinogenesis, which is the formation of cancer. Lastly, diabetes may be a cause, as well as chronic pancreatitis. It would just lead to pancreatic cancer. Now, pancreatic cancer is very, very, very severe because it progresses so rapidly and metastasizes so fast that we don't even know we have the cancer until it's fully developed. With that being said, individuals are diagnosed in very late stages, and sadly, their life expectancy is 3 to 6 months to live. It's estimated that 23% of patients survive up to 1 year after this diagnosis. Very complicated disorder, guys. Now, the manifestations seen reflect that of cancer. We're going to see those caution signs as well as the constitutional signs, which is in my cancer video. Go check out the cancer presentation to see what those signs are. Anyhow, pain will be manifested along with those liver problems, such as jaundice, dark urine due to the bilirubin being in the urine, pale and greasy stools, along with the fatigue, weight loss, and anorexia, which is a decreased appetite, which will lead to the weight loss, guys. Now, pancreatic cancer can be diagnosed by ultrasound, CAT scan, or an MRI, but the most optimal way to see if cancer is within the cells is by doing a biopsy, cutting out a piece of the pancreatic tissue and examining it. Now, a biopsy can confirm what stage and where the cancer has metastasized. Biopsies are the optimal way to go when diagnosing cancer. Lastly, a ERCP can be done, which is a endoscopic retrograde cholangiopancreatography. And this procedure provides a visual of the pancreatic and bile ducts within the body, guys. And we've reached the end of this presentation. As mentioned before, follow this video up with my liver disorders video or my presentation on cancer. Thank you guys for watching. Hope you enjoyed. Hit that like button, subscribe to the channel, drop a comment, and I'll see you guys next time.